Jackston. He is a consulting physicist and a senior policy civil servant in the UK government. He's senior inspector for medical exposures using ionising radiation to national and international organisations. He's a Fellow of the Royal College of Radiographers and an Honorary Fellow of the Royal College of Physicians in recognition of his work. Thank you.
Thank you very much. If we think about medicine in general, the system of protection for safety practices in medicine is effectively governed by the system of medical ethics. And that's great. We're all aware of that. It's been like that for a long, long time. But there are exceptions, and the community that we work in is the major exception. Those communities that utilize radiation, and specifically medical imaging, don't tend to look to medical ethics as their framework or system. Instead, we tend to think about our framework coming from radiation protection, as laid down originally for occupational and public exposures. Now, that was fine when people got one X-ray in their life, or later on one CT. But from about the 1970s, and certainly in the last 25 years, we've seen this massive growth, particularly in imaging. And this has led the community to start to think again. And we need to think about having an explicit reference to ethics within our field and within our practices. And two organisations that looked at this are ICRP and WHO. And in 2019, the WHO convened a workshop, a stakeholder workshop, to look at this and invited ICRP to come along too. Now, I'll come back to that and the details and the outputs of that later on. But I think one of the key things that came out of that workshop was that everyone in the radiological community thinks we're acting ethically. We're not quite sure what that means. We each have our own views. Now, if you ask people about the principles of justification, optimization, and dose limitation, we all know those. I'll address those. They've been there for years. But the ethics values that we are thinking about that apply to us are these listed here. Most of you will have seen the words, but a lot of you won't know how they apply to the journey of a patient through an imaging system. And to be honest, I think it's about time we did. And particularly if we look at honesty and transparency and ask ourselves on a daily basis, do we consent to patients for simple examinations? Do we need to? Do we just rely on the fact that they turn up? Do they know what's going on? All these are things that are ethical concepts that we need to apply to the way we practice. And if we did, I'd contend that what we would be doing is supporting this whole process of moving decision-making from a paternalistic doctor knows best approach to a shared patient-centered care system, and it will allow patients to share in their decision-making far more effectively than they're able to do so now. Now, we've heard, as I say, justification and optimization and dose limitation are the three ICR principles of radiation protection that we apply. The framework that we have for our safety is developed on three components, and these have been developed over time. Originally, they were developed by professional development 100 years or so ago. Then we had an institution of regulation and governance, and latterly we've seen safety culture emerge as a factor in the way that we use radiation. But again, the framework, even with these three components, was originally developed for occupational exposure, then applied to public exposure, and only finally are we trying to apply this to patient exposures. Now, we can invent a whole new system, or we can try and say, well, the medical ethics system is over there, and we can think about that while we're getting on with our own framework and our own systems. But surely it would be better to integrate ethics values into the system that we have already, that with professional development, regulation, governance, and safety culture. And that's the way it's going, friends, and that's the way it should. Now, if you're going to change things, you have to have strategies. We all know this. Without strategies and approaches, then we get nowhere. So we need acceptance from the community that this is the right way to go. We need acceptance from the community that there is a deficit exists now, and we can address this by applying ethics values. Now, if we're going to do this successfully and get acceptance from the community, we have to have professionally mandated values and approaches, and we need purpose-specific tools in terms of education and training that help people along the path, because this isn't an easy concept for us to add on at this stage. A lot of people out there think we've got it sorted out with our 3s and 3s. So we need an implementation program after we've got the values and the purpose-specific tools developed. And that's got to address management, and it's got to address you and me and others who have medical radiological imaging roles. Now, this doesn't happen overnight. You need the tools, you need the acceptance, and you need adoption, and you need leadership. We need leadership, motivation, and support, not only locally, but also internationally and nationally. And that's why we're talking at conferences now. So I referred earlier to the WHO workshop in 2019 held in Geneva. There were 48 participants from 28 countries, and essentially, as I've said, it identified some key deficits and key things that WHO might do. And the WHO has gone off and done something. So on the 12th of April this year, a policy brief for healthcare providers was issued by WHO. Now, it's easy to find, and it's not very long, and it talks about some of these things that I've talked about today, but it also includes a case study. Now, I'm not going to go through the case study now because we don't really have the time. The case study may or may not apply completely to your country, but it's basically talking about what a patient might experience, a somewhat privileged patient, in fact, who comes into an institution and the department wants to do the best for that patient. The trouble is, by doing so, they forget some of the ethical values or ethics values that we've discussed earlier. And what the case study does is go through the example and highlight how those ethics values apply to different parts of the healthcare pathway. So I would ask you as homework from this talk to go away and look at that ethics brief, that policy brief on ethics in radiological imaging from the WHO, and see how you feel it applies to the way you work and how others in your country might work also. Now, the WHO has also, at its launch, accepted that it needs to do more. We know ICRP will issue more, but the WHO has a unique position in terms of healthcare. And one of the things that it will be doing is producing guidance and support materials for professional stakeholders, but most specifically for patient advocates and patients themselves. And in fact, I hope that the first piece of work that will come out of the WHO continuation from the policy brief is some very specific advice to patients on how ethics values apply to their experience. Now, that could be in terms of videos or something on YouTube or whatever we think will get across to patients the best. I think in the future we'll see perhaps a more comprehensive guidance document, a more conventional document that will look at things from the perspective of the management, from governments, from health technology assessment organisations, as well as highlighting those patient issues and patient advocacy issues. So we believe, or I believe certainly, that this is a piece of work that's beginning and will develop. And in a few years' time, I hope we will consider this to be part and parcel of our daily practice. Not going to be easy, but I think it's valuable in the same way as we've adapted and adopted safety culture to what we do. I'd just like to finish by thanking those people who were on the WHO working group that put together the policy brief. I've highlighted two because I don't want to embarrass highlighting Dina Husseini Salama, who is in the audience today, who was a very instrumental part of that group. So I haven't highlighted her, so I won't embarrass her. But I would like to thank Maria del Rosario Perez, who has recently retired from the WHO, whose energy we will all miss. And I would like to acknowledge Jim Malone from Ireland, who was one of the major writers of this piece of work. Jim is my mentor in this subject, and no talk should go on ethics without mentioning his name. Thank you for your attention.
Thank you very much, Dr. Steve, for giving this great lecture about ethics in medicine and in radiology. And now,